Boy, so let's unpack this. We are doing a deep dive today into one of the most crucial yet, well, often overloaded pressure points in the entire medical system. We're talking about healthcare referral management. I mean, when you think about getting care, you probably think about the doctor, the diagnosis, right? But today we are focusing on the pivotal administrative glue that links every single part of the system together. Every
Yeah.
doctor, specialist, hospital, diagnostic center.
Yes.
It's that moment your primary care physician decides you need, say, an MRI, or when a hospital needs to transition you home with specialized nursing. That whole process, the referral, is the subject of this massive and, frankly, long overdue digital revolution.
It really is.
And for you, the listener, this deep dive is really about understanding the stakes. We've compiled sources that detail this stark, almost jarring contrast between the manual systems that dominated for decades and the modern digital solutions we see now.
Right, and our mission today is pretty clear. We're giving you a shortcut to understanding why this shift to digital isn't just an option anymore. It is absolutely becoming a necessity for any provider operating today.
A necessity.
A necessity. And we're going to move past the generalities and focus on three key pillars: how digital solutions deliver measurable operational efficiency, how they dramatically improve the ultimate patient outcome, and critically, how they deliver some substantial cost reduction across the board.
Okay, so let's start with what you called the horror show. We need to really appreciate the dysfunction of the traditional system. We're talking paper forms, endless phone calls, the fax machine buzzing in the corner. Why did this analog methodology fail so profoundly?
Well, the failure is multifaceted, but
Yeah.
it really boils down to the fact that paper-based systems rely on sequential human actions. Every single step is a potential point of failure.
Like potential bottleneck.
Exactly. And the single biggest problem is simply speed, or the lack of it, the delay. The referral process is just inherently slow. It starts with paperwork, then it moves to phone tag, then it gets stuck in the fax queue. In high-stakes situations like discharge planning, these delays are just crippling.
Tell me more about that discharge planning. Why is the referral process so critical right at that moment?
Because that's the moment the patient moves from a highly controlled environment, the hospital, to a fragmented, often home-based one.
Right, they're on their own.
In a way, yeah. So if the referral for, say, physical therapy or home nursing or specialized equipment gets delayed by even 48 hours because the staff couldn't connect with the outside provider, the patient's recovery just stalls.
And what did the sources say about that time frame?
They show that the average time spent just processing a referral in a manual system often exceeds a week. A week.
Yeah.
And that's before the specialist even sees the patient.
A week. Wow. And when you have that much reliance on manual intervention, you're introducing one of the costliest elements.
Human error, inevitably.
Right.
When you have to rely on transcription, a nurse calling an outside clinic and verbally trying to convey complex patient info, or manually entering data from a faxed form, the risk of high human error just skyrockets.
So we're not just talking about typos.
Oh, no. We're talking about simple mistakes, like transcription errors in a medication dosage, or really complex ones, like entirely missed referral because the fax got misfiled.
That seems almost unbelievable in this day and age. Is that a small percentage of errors, or are we talking about something systemic?
It's systemic and surprisingly common. One of the more shocking nuggets from our source material suggests that in these purely manual environments, up to 1 in 5 paper referrals gets lost.
1 in 5.
Yep. Lost, misdirected, or delayed by over a week. That isn't just an inconvenience. That is a failure to coordinate care that directly impacts the treatment timeline.
And that failure to coordinate, that leads us right to fragmentation. If I'm the patient in that system, I feel like my 5 different doctors are operating in 5 different universes, and I'm the only one trying to hold it all together.
That's the feeling, because that's the reality of fragmented coordination. When processes are manual, coordination requires constant, active, manual follow-up. The referring doctor sends the fax and just hopes it lands.
Yeah.
Then they have to dedicate staff to hours of phone tag, chasing down whether the specialist got the documents, if they scheduled the appointment, or critically, whether they even received the diagnostic orders.
And without that tight coordination, tests get delayed, right?
Absolutely. Think about diagnostic orders, like ordering a specialized MRI or a complex blood panel. If that order is held up by just, administrative miscommunication between the referrer and the specialist, the entire treatment timeline gets thrown off.
And no one knows what's going on.
No one. And this is a huge source of frustration for everyone. There is such limited visibility into referral statuses. Is it received? Is it approved? Is the appointment scheduled? The traditional system answers that question with a shrug.
The who knows factor.
Exactly. It creates mass confusion.
Okay, so that lack of transparency is the headache that drove this transformation. We've established the horror show of the fax machine era. Now, let's talk about the solution. What does the digital side actually look like when it's working perfectly? How do these modern systems directly counter every single one of those traditional weaknesses?
Well, we move from those sequential manual steps to instant, centralized, real-time connectivity. The operational game changer really starts with instant processing.
Yeah.
Instead of a referral sitting in an inbox or a fax queue, it's created and transmitted digitally, often leveraging the existing electronic health records, the EHRs.
So it's immediate.
It means the referral is received and acknowledged instantly. That immediately cuts down on those days-long, crucial delays we see in care transitions.
So speed is step one. But what happens when we solve that structural problem of different systems not talking to each other? How does digital centralization handle that fragmentation?
This is key. Digital systems create what the industry calls a connected transition experience. It means moving away from that old model of Dr. A faxes Dr. B.
Into the void.
Into the void, yeah. To a centralized ecosystem. All involved providers, the primary care physician, the specialist, the lab, they all access the same platform or secure interface.
So the primary care provider isn't just sending a request and hoping for the best. They're actively engaging in the scheduling process.
Precisely. In the most advanced systems, the referring physician can actually see the specialist's open scheduling slots in real time.
Oh, wow.
And they can often confirm the appointment instantly right then and there with the patient sitting in the room. This removes the entire multi-day back-and-forth phone tag process.
And I imagine that helps with trading staff, too.
It does. Because everyone is looking at the same centralized data pool, the training burden is minimized. The workflow is standardized. It's visible.
That's a huge improvement in coordination. But what about the actual data, the integrity of it? Are these systems also cutting down on those costly human transcription errors?
Absolutely. This is where automation really shines. Automated data entry reduces the high risks tied to manual transcription. So instead of copying information from paper to an EHR, the system pulls the required patient demographics, their history, current medications, directly from the secure electronic file.
Which ensures accuracy.
And consistency.
Yeah.
Across the board. And it ensures completeness, too, which was a huge failing of that old fragmented system.
Right.
The patient data is shared securely and in real time, making sure the specialist gets the complete, comprehensive information packet immediately. You move away from that dangerous problem of incomplete data, where the specialist might not have a full medication history or a crucial recent lab result.
So the system is just designed for data integrity from the get-go.
From the start.
And that centralized dashboard, that finally gives us the transparency we lacked. Everyone knows the status.
Yes. The system automates referral tracking, giving providers, administrative staff, and often the patient themselves real-time visibility into the status. This visibility allows for much better resource allocation and scheduling. Instead of guessing or manually tracking down an appointment, administrative staff can see bottlenecks immediately and adjust.
So it turns a fragmented, difficult-to-track process into a
transparent, measurable workflow.
That shift from analog confusion to digital clarity sounds incredibly efficient. So now let's pivot to the larger impact. What does this all really mean for the patient experience, for the clinic's bottom line, and for, maintaining regulatory standards? The benefits have to cascade far beyond just faster processing times.
Oh, they do. The operational improvements we just discussed translate directly into crucial outcomes. For the patient, we see a massive enhanced experience and true continuity of care.
Better care.
Better, smoother care. Faster referrals leads to quicker appointments, sometimes cutting waiting times from weeks to just days. And because the data transition is smooth and accurate, the patient doesn't feel like they're starting from zero with every new provider.
I can imagine the emotional benefit alone is just huge. That period of waiting for a specialist appointment can be incredibly anxiety-inducing.
It is. The anxiety and uncertainty from waiting for a diagnosis that was heavily linked to that lack of visibility. Digital systems address this by giving patients real-time updates, maybe via text or a patient portal, which reduces that psychological burden.
And what about missed appointments?
We see a significant drop in those, which are a major drain on time and resources. Automated reminders and follow-ups ensure patients actually attend their scheduled visits, overcoming the high risk of just relying on manual scheduling calls.
Those missed appointments and unnecessary tests, that feels like the massive hole in the healthcare budget that these systems are designed to plug.
It leads directly to significant cost efficiency and waste reduction. This is a major point in our source material.
Right.
Think about what poor communication costs us. Duplicate tests. A specialist unsure if the faxed lab results from 2 weeks ago are still relevant, or maybe they just can't find them.
They just reorder the test.
They just reorder the test. Digital systems eliminate this waste through accurate, immediate data sharing.
And that connects directly back to reducing readmissions, which is one of the most expensive failings in all of healthcare.
Absolutely. Poor communication during discharge planning is a primary driver of costly readmissions. In the old paper system, a critical instruction on a discharge summary like specific dietary needs or a post-surgical care routine could easily be overlooked or misplaced during the transfer.
And the patient ends up back in the hospital.
Exactly. Digital systems ensure that the entire accurate discharge packet with full medication reconciliation and care instructions is instantly visible and auditable by the receiving facility. By closing those communication gaps, you prevent the patient from suffering a relapse that lands them back in the hospital a week later.
So the system is reducing clinical errors and saving vast amounts of money by making sure the right thing happens the first time.
Precisely. And while all this efficiency is improving patient care, the administrative staff is getting significant relief. There is a massive reduction in the sheer volume of paperwork, faxes, and that heavy reliance on constant phone tag.
Which frees them up to do more important things.
It frees them up for duties that actually require human judgment, complex problem solving, or direct patient interaction, rather than spending hours manually reconciling faxes and charts.
Okay, before we wrap up the benefits, we have to address the security elephant in the room. If we're centralizing all the sensitive data, doesn't that just create one massive, tempting target for hackers? How do the sources address that risk?
That's a critical and necessary challenge to raise. And while no digital system is entirely immune, the consensus is that digital management offers vastly superior security compared to traditional methods.
Really?
Yeah. Unsecured paper records and faxes are inherently vulnerable. They can be physically lost, stolen, or viewed by unauthorized personnel far more easily than an encrypted digital file.
So the move to digital is actually a security upgrade, provided it's implemented correctly.
Correct. Modern systems use high-level encryption, secure data storage, and strictly regulated access controls. And crucially for institutions, these systems offer built-in compliance features, which is especially important for regulations like iPay.
Ah, the audit trail.
Exactly. They provide automated, time-stamped audit trails for every single access, edit, and transmission. Maintaining regulatory adherence becomes exponentially easier than trying to track a paper trail. The digital system essentially tracks compliance for you.
So if we look at the full spectrum of benefits, the immediate speed and error reduction, the cascading cost savings, the enhanced patient security, it seems the source material is unequivocal. The shift from traditional to digital referral management isn't just an improvement, something nice to have. It's an unavoidable necessity in modern healthcare.
That is the definitive conclusion. Modern healthcare is just too messy, too high volume to run on outdated manual processes anymore. The complexity requires tools that can handle seamless, high-volume data coordination. And the defining aspects of this necessity are clear. Vastly improved operational efficiency, seamless care coordination between every facility, a drastically better patient experience, and those tangible financial benefits.
The scale of this change is staggering. It touches every single part of the healthcare ecosystem. But there's one final fascinating point our sources raise, and that's about the massive amount of data being generated by these platforms.
Yes, these digital systems aren't just faster. They are sophisticated data collectors. They gather valuable data for performance tracking, resource allocation, and continuous process improvement.
They quantify everything.
Every step of the journey. How long did it take provider A to approve? How many days passed before the patient scheduled? What percentage of referrals to provider B resulted in a successful appointment?
Which raises a crucial question for you to consider as you process this deep dive. Now that digital systems can track every moment and measure every delay and success in the referral process with complete transparency, what new demands or opportunities will this real-time, quantified data place on the clinical staff who must constantly prove their efficiency and justify their workflows?